Thank you. Hello, everyone. My name is Ishan Patel. I'm one of the authors of this article, Epidemiology of Total Hip Arthroplasty, Demographics, Comorbidities, and Outcomes. First of all, I just want to thank everyone at the Arthroplasty team for selecting our article for the Gold Award. So thank you so much for that. In terms of disclosures, we have nothing to disclose. So for background, total hip arthroplasty, we all know it is a successful procedure. It's amongst the top 5 most common and fastest growing procedures in the United States. It fails for reasons such as instability, infection, loosening, implant failure, and this failure poses a significant burden to our patients and our national healthcare system. So the prevalence of total hip arthroplasty in the United States amongst adults aged 50 or older was estimated to be about 2.34% in 2010. And as our paper shows, that this has obviously increased. And as the incidence of total hip arthroplasty increases, a 43 to 70% increase in the frequency of revision total hip arthroplasty from 2014 to 2030 has been similarly projected. So the aim of our study was to provide a better understanding of the demographics, the comorbidity profile, and in-hospital outcomes of patients undergoing total hip and revision total hip arthroplasty. And in reporting the statistics, we aim to provide a baseline structural understanding of common demographic and medical characteristics of total hip and revision total hip recipients, which might guide perioperative protocol development and improvement. So in terms of our methods, a retrospective analysis was conducted of discharge data from 2006 to the third quarter of 2015 using the National Inpatient Sample Registry. This is a database that accounts for about 20% of inpatient stays across the United States. And this includes information such as demographics, comorbidity profiles, in-hospital outcomes, as well as the revision type and the reason for the revision total hip arthroplasty. Our inclusion criteria was for the study was defined as patients aged at least 40 years who underwent total hip or revision total hip. We used ICD-9 codes to identify the patients. And that's the reason we only had data up until the third quarter of 2015 was because after the third quarter, they switched to ICD-10. We wanted to keep our data homogeneous, so we only included the third quarter up until the third quarter to keep everything as ICD-9 codes. And then revision data along with demographic data, in-hospital outcomes, and comorbidity profiles were collected. So results, we had about 2.8 million total hip arthroplasty patients and almost 401,000 revision total hip arthroplasty patients, which were included in this study. The average age in total hip arthroplasty and revision total hip arthroplasty groups was 65.98 years and 68.54 years, respectively. The major primary payer for both total hip arthroplasty and revision total hip arthroplasty was Medicare. And in terms of race, the non-Hispanic whites were by far the majority recipients of both total hip and revision total hip at 74.8 and 74.4% of discharges, so meaning procedures. This data was plotted using the number of discharges from the hospital for patients that received these procedures. So we translated that to mean the number of procedures that were performed. So you can see from 2006 to 2015, there was a steady increase in procedures being performed for both total hip and revision total hip arthroplasty. We do have a dip in 2015, and likely this is accounting for the fact that we only had 3 quarters of data instead of the full 4 quarters of data for 2015. In terms of the comorbidity profiles, hypertension appeared to be the most common comorbidity in both total hip and revision total hip cohorts at 60.46 and 59.7, respectively. The most prevalent conditions in the primary total hip group were hypertension, obesity, COPD, hypothyroidism, and diabetes. And in terms of the revision group, it was hypertension, anemia, COPD, fluid and electrolyte disorders, and then hypothyroidism. This is one of the charts from our paper. This is the in-hospital outcomes that we collected. So in terms of any complications, for primary total hip, the rate of any complication was 27.3%. And of these, postoperative anemia, followed by hematoma and seroma accumulation was for the 2 most common. And then for the revision total hip, again, any complication rate was 39.46%. And then of this, postoperative anemia was 35.69, and then followed by hematoma, seroma, and then postoperative infection or wound dehiscence. We also looked at the cost of these procedures. So based off of this sample, the total cost for a primary total hip, the average cost for a primary total hip patient was about $53,000. That's US dollars. And the length of stay for these patients were on average 3.3 days. And then for the revision total hip arthroplasty patients, the average cost tended to be around $75,000, and the length of stay was about 5.3 days. This chart here kind of demonstrates the reason for patients having revision total hips and then the type of revision that they had. So by far the most common reason for revision was dislocation or instability, which accounted for about 21.85%, followed by loosening and then other mechanical complications. In terms of the type of revision, the most common type was of all components, both the femoral and acetabular component, followed by the femoral component, followed by the liner or head exchange. So our analysis of 2006 to 2014 data demonstrated that demonstrated a 69.5% increase in patients receiving primary hip and 28.5% increase in revision total hip arthroplasty, which is a pretty staggering number. So as the volume of both index and revision procedures increases yearly, and as reimbursement systems shift towards value-based models, there is a heightened focus that's been placed on resource utilization and the quality of care that needs to be delivered. Just to kind of give an example to that, a failed total hip arthroplasty results in a revision, and with a reported average cost of about $75,000 per procedure. This totaled about $30 billion from 2006 to 2015. In this study, an increase in the rate of revision total hip was noted to be in this an increase in the rate of revision total hip was noted between 2006 and 2015, with dislocation as the most common reason for revision during that time period. The most crucial independent variable which may predispose patients that we found in our reviews was implant position. So specifically positioning of the acetabular shell. So there's different things out there that kind of there's different studies being done out there that make help surgeons place the acetabular shell better. One of the big things right now is robotic assisted total hip, which helps with implant positioning. There's a study that was recently done by Shah et al. With a cohort of about 2,200 patients, which showed a dislocation rate of about 0.6% with robotic assisted hips versus 2.5 versus the conventional total hip group. And something to kind of keep in mind as we move forward, increasing the amount of procedures that we're doing, looking to other technologies to help decrease the risk of complications. So here's another thing that we worry about is our aging population. So currently there's about 46 million geriatric patients that are living in the United States. This is expected to grow to about 90 million geriatric adults based on a 2050 projection by the United States Census. So our study data revealed that the average age of patients undergoing total hip was 65.98 and revision hip was 68. And as the population ages and as baby boomers reach geriatric age, the reported average age of total hip is about 65. And so the projected significant increase in the amount of total hip, and there should be a corresponding increase in the revision total hip procedures being performed as well. And furthermore, increasing the age would also account for an increased amount of comorbidities in these patients, which would further impact rates of complications in patients receiving total hip arthroplasty and revision hip. So this study kind of reported on all comorbidities that constitute the Illig-Zauser comorbidity index. There was a study that was done in 2020 by Delatte et al., which reported reduced length of stay and less subsequent ER visits amongst patients who underwent preoperative optimization. So our data noted that the most common comorbidities in total hip and revision groups were hypertension, obesity, COPD, hypothyroidism, diabetes, anemia, fluid and electrolyte imbalance, and depression. Obesity is a really well-studied comorbidity within the total hip group. There's tons of papers out there on that. It was the second highest comorbidity in the primary total hip arthroplasty group, and the sixth highest in the revision group. Previous studies have shown that increasing BMI is associated with things like increased length of stay, increased cost, increased blood loss, dislocation rates, which can in turn lead to a variety of postoperative complications. Other comorbidities such as diabetes and hypertension have also been shown to affect preoperative outcomes. However, these are less well studied. So optimization from these pre-existing comorbidities can lead to decreased length of stay, decreased postoperative discharge ER visits, and also provide value by reducing the cost burden to our healthcare system. So it's important to study these. There's some of these that have been well studied and some that have not. The limitations of our study: this is a large database, so it does remain prone to frequent errors such as errors from human error from manual entry, as well as suboptimal coding systems. It is limited to inpatient data, and so it does not allow for for a complete assessment of postoperative clinical and economic outcomes beyond the immediate in-hospital period. And the registry does not provide information such as operative technique, preoperative diagnostic information, which would be helpful in further highlighting reasons behind complications following the surgeries. In terms of our strengths, to our knowledge, the study constitutes the largest available comprehensive report at the population level, delineating notable medical comorbidities of primary and revision total hip arthroplasty patients. The substantially large volume of data and long duration study provides a generalizable cross-sectional understanding of demographics, comorbidities, and clinical and economic outcomes following these procedures. And this knowledge can potentially empower clinicians with a deeper understanding of perioperative conditions that might impact postoperative outcomes and development and implementation of preoperative optimization pathways that are geared to target these conditions. So in conclusion, this study assessed demographics and epidemiological characteristics of total hip arthroplasty and revision total hip arthroplasty recipients between 2006 and 2015. And it reported significant medical comorbidities and postoperative outcomes associated with each cohort. And so in an area of value-based care where focus is placed on achieving higher quality while simultaneously optimizing the efficiency of an episode of care, developing understanding of patient-specific comorbidities is important to designing personalized care protocols that can help improve outcomes. And while some of these medical comorbidities have been extensively studied, this study did identify some gaps that will allow future studies to further assess additional comorbidities that were noted to be commonly encountered during total hip and revision total hip recipients. That's all I have for you guys. Thank you so much.